Sri Sridhar Babuji. Great to have you here. And I wanted you to be here because I met you once in my clinic. And I was extremely impressed by your knowledge, by the way you talked. And then you said you're part of the Congress party. And then I remember those voices, just wait till we come into power. This was before he got elected. And then I was so, and when we planned to launch the robot, first name that came to me was, is extremely knowledgeable. He's now the IT minister, and I'm sure he'll understand more about this than anybody else. So, a very warm welcome. Thank you for coming. So, my inspiration has always been my father and my grandfather. Growing up, when he was surrounded by people, he had no time for us. And whatever time he gave us was very precious. And those Sunday evenings, we used to go to Rotary Park and swing on the tank over there, and then on the way back, stop at a restaurant and have something. That was the only time we really had with him. He was a very busy man. So along the way, I had no choice but to become an orthopedic surgeon. And after those 20 odd years in England, having trained fully, come back, India was a big, big challenge. It was such a big challenge that every day I used to think, what a mistake I made. But the 20 years in England that I was there, and then as a consultant, every time I used to come here, I used to do these extremely challenging cases that my father used to keep for me. He said, if you come back to India, you must come back as a revision surgeon, because there are a lot of surgeries that are not going well, and you must know how to deal with revising those surgeries. And this is what I specialize in. I specialize in revision and very complex joint replacement for trauma surgery. So when we came back, I said that I think we need to move on from a small place to a big place, because in modern surgery we need modern environment and modern ecosystem. And this is how we created this after partnering with Omni Hospitals. Surya, who's not here, who's the CEO, the director of Omni Hospitals. He was more like a friend, and he then came in and partnered with us, and then we came up with this beautiful place. And we have ultra-modern theaters. Because I came back from England, I said, even if this is an inner city hospital, I want to follow the rules of the government. And we followed to the last inch. You will see that around the hospital there's 6 meters of space, and none of the new buildings here have any of that. 6 meters of space all around for a fire engine, and 5% of the land area for an open area for gathering in case there's an emergency. So I just wanted you to know that as well. So we have ultra-modern theaters, clean air. We have almost zero infection rate in our hospitals because we have a laminar flow, a vertical laminar flow air system. And then over time, we decided to invest in modern technology, and the robotic systems that other hospitals earlier talk about, they had bought all these systems which we couldn't afford. These people couldn't afford, but we couldn't afford it, because they're far too expensive. They started off with something like 13 crores. But I'm glad, I came to know about an Indian company that were making high quality implants. And like other great names in India, these people went and bought an American company. So Indians have acquired an American company and then started making those kind of implants in India, as well as importing them. And then they saw that the doctors are really interested in technology and wanted to make knee replacements more reliable. And this is how the robotics came into India. And they got hold of a whole group of IIT youngsters who said, yes, we can do this, no big problem. So within a couple of years, they came up with a robot, which is totally indigenous. And the software is done by Indians. Some of the hardware has been imported, but by and large, this is an Indian product, which we're so proud of. And it is now competing with the best in the world. It is moving into Europe and America and getting their permissions to start demonstrating. I heard that there are a group of Italian surgeons coming to this hospital to see this robot demonstrated to them on patients. So we're glad to hear that. So what this robot does, basically, people ask me, you've been a consultant for 20 years, you've been doing operations for 20 years, why do you need this thing? The thing with knee replacement is that there's a high dissatisfaction rate even amongst the best surgeons, because the conventional surgery only restores the alignment in one way, and this is a uniform alignment for all human beings. But we all know that human beings are very different. So even their leg alignments are slightly different to each other. So a human being is happy with his own alignment. If you give him a certain alignment that you think will work for him, he may or may not be happy. So the success of a joint replacement is not how long it lasts, it's how happy the patient is. What score will you give it compared to your old knee, right? So does it feel more natural or not? These are the answers I'm interested in as a surgeon, because anybody can do a knee replacement. It is how happy, from a score of 0 to 10, are you satisfied? What is your satisfaction rate? This is what I am interested in. So when I started learning about the robot, what I found was it actually restores the alignment. Yes, thank you. So what the robot does, it restores your native alignment. When you restore a native alignment of that particular person, they are far more happier. And it balances the knee in every degree of movement, from 0 to 120 degrees. So the knee feels much more balanced, and you can then, with that, you can walk 10 kilometers, go skiing, play golf, go up and down a mountain. It feels like a natural knee. This is what I am interested in. And this is what this thing helps me do, much more precisely. So it gives me a balance and a precision that human eye and conventional instruments cannot achieve.